Copper is an element that is essential for organic function and metabolic process in the human body. Too much or too little copper can be poisonous. Wilson's disease is a rare inherited disorder in which excessive amounts of copper accumulate in the liver and brain.
Mallory Smith was diagnosed with Wilson's disease in 2006, a month before she started her senior year in high school. Her best friend Lauren agreed to meet with us and tell us about the impact it had on her life. How did you find out Mallory had Wilson's disease?
When I got a call that Mallory was admitted to the emergency room, I was so scared. The doctors started running tests on her to find out the sources of her symptoms, and that's when they discovered that she had a severe illness called Wilson's disease.
How did this make you feel?
I got a call from Mallory's parents telling me that Mallory had been taken into the hospital because they were concerned about some of the symptoms that she was having. And when I went over, I found that they had been running some tests to find the source of her symptoms, and this is when they told Mallory that they have Wilson's disease.
Tell us about Wilson's disease.
Wilson's disease is a genetic disorder that prevents the body from moving extra copper. Usually, the liver expels extra copper through bile. Wilson's disease causes that copper to build up in the liver, the brain, and other organs.
Can you tell us about the possibilities of getting Wilson's disease?
Wilson's disease occurs when two homozygous recessive alleles have a mutation in the ATP7B gene. The chances of getting it are 1/4 or 25%. If both parents are carriers or a parent has disease themselves, but if only one parent has the gene for the disease, the child will not have it, but there is a chance that he or she could be a carrier.
What symptoms did Mallory have?
The symptoms that the doctors were concerned about were that Mallory had nausea, abdominal pain, and jaundice. And jaundice is just when your skin and the whites of your eyes turn yellow.
We know what symptoms Mallory had, but is there any others?
Most common symptoms include fatigue, lack of appetite, easy bruising, problem with speech, swallowing or physical coordination, uncontrolled movements, and muscle stiffness.
Can you tell us about treatment for Wilson's disease?
Common medication used to treat Wilson's disease are penicillamine, triazine, and zinc.
Can you explain what this medication does specifically?
Well, penicillamine is used to remove copper from your body through urine. Triazine is an alternative to penicillamine, but with less side effects. Zinc prevents body from absorbing copper from your food.
Is there a stage of Wilson's disease when you need a liver transplant?
It depends on how damaged the liver is and how well the prescription is working. 3.
What medications did Mallory use?
After diagnosis, Mallory was in need of a new liver, and when she got the liver transplant, she had to spend 24 days in the hospital before going home. After that, she kind of started living her life again and just going to school and doing all of her normal stuff. But after 5 months, her liver started showing signs of rejection, and they spent 6 months trying to save her liver. But afterwards, she received really sad news that she needed a new one. And her second recovery wasn't as successful because she experienced problems with her kidneys, and she had to be put on dialysis.
You can't prevent Wilson's disease. However, if any of your family members have been affected by it, you should talk to the specialist. After Mallory was released from the hospital, she started participating in different fundraising events